So I think when we think about open ventral hernia repair, there are really two major questions that we have to answer as surgeons. The first is the technical question of where are we going to place the mesh. I would argue that a mesh underlay, either in the intraperitoneal, the preperitoneal, or the retrorectus space, are the appropriate places to place the mesh. The second big question is, can we achieve fascial closure over top of the mesh? I think fascial closure is very important from a physiologic standpoint, from the standpoint of minimizing the risk of mesh infection, and also from a cosmetic standpoint. In a patient in whom we can easily achieve fascial closure in a primary fashion without tension, obviously that would be the strategy that we would use. In some patients with big defects, we simply can't close the fascia over the mesh. That's going to be the patient that may benefit from a component separation, either through an open approach or an endoscopic approach, releasing the external oblique and or releasing the posterior rectus sheath. So I think there are kind of two big questions. Where do we put the mesh, and how do we achieve fascial closure?